Well, thank you, Sharon. As mentioned, I am Bill Hall, a commissioner from Lincoln County, and I am the treasurer on COG's executive committee. This is my 11th year in office and also my 11th year on the COG board. So let's begin by reviewing the project and the data. Over a year ago, the COG began a comprehensive look at how to better conduct original research, answer policy and program questions, and inform ourselves of the opportunities and obstacles that we face as a region. We convened a small but focused community leadership group to discuss how to progress on the issues. Topics like homelessness, regional transportation, access to medical care, and the loss of community banks were discussed and put on an agenda to discuss. The most pressing topic was that we need to know what we don't know. We need data. And that was the genesis of the State of the Region, to begin a comprehensive data collection to prove that we can, and to prove that we can do a lot more together. The report that you received today and the companion website, stateoftheregion.org, pull together information from almost 400 data sets and data tables collected from almost every publicly accessible data center, 55 map layers, and 950 hours of analysis to start the discussion that I hope we're all willing to have. The data are not comprehensive, but provide a snapshot of the region that we hope helps inform local decision makers, as well as future discussions about our collective priorities, investments, and vision. The data allow us to explore the region spatially. The data also allow us to view the region over time. And we can also use data to baseline our region in comparison to other similar regions, which we did by collecting data from regions in Texas, Idaho, and Arizona, states with peer regions that have similar populations, universities, and colleges of similar size, and similar geographic characteristics. With this information, we can conduct data-informed decision-making through which we collect data, analyze it, and use it to guide our decisions to improve success. And our region's communities are bristling with data. When we collect it and analyze it, we can focus our scarce resources in the most effective way possible to better help our communities prosper. When we look at our demographic and geographic data and combine it in different and unique ways, it can also tell us things that we didn't expect. How does trade flow in our region? Where are businesses opening? Who needs what health care and why? These are complex questions that require complex analysis, and through projects like the State of the Region, we can begin answering them. Going forward, you'll be able to explore this data and more at www.stateoftheregion.org. When you see the data, you see that we are a complex region, full of diversity and opportunity. The question we pose is what to do with all this data and how to make it work to our advantage. We are not so big that the data is overwhelming. For example, in major metropolitan regions like Phoenix, being able to reach consensus across such large and diverse populations is next to impossible. In fact, it may be possible to solve some of our toughest local issues once we have the data to show what we are dealing with. When we look at our region, the most logical place to start is with who makes up our region. So let's start with our demographics. Demographics and community indicators are the lifeblood for understanding service delivery, education, workforce, health, and other social areas that we plan for. These data tell us who we are and how we change over time. Let's explore the demographic and community indicators of our region. From this graphic, we see that 50% of our region's residents are married, 85% are white, and 37% have completed some college or have an associate's degree. Each county in our region is distinct, and each of us participates in a demographic group that suits our lifestyles and needs. However, averages can tell us a story. Our region's typical resident is named Jennifer. Hi, Jennifer. She is the prototypical Jennifer, not necessarily our Jennifer, is 39 years old. She is married, and has 2 children, and is a high school graduate with some college education. Data about the economic and demographic makeup of a region can provide a broad overview of the commonalities among our region's residents. Taking several factors into consideration, the profile of an average resident emerges. For example, this demographic wheel graphic shows us some of these common traits. As I mentioned, we know that 50% of our region's residents are married. We also know from the Social Security Administration that Jennifer was the most common name given to females born in Oregon in 1976, hence the name. We know that Jennifer was born in 76 because the median age of residents in our region today is 39. So why is our typical resident female and not a male? That's because, according to the U.S. Census Bureau, our region is 49.4% male and 50.6% female. Growth rates are also important indicators of community health. Too slow and our region stagnates. Too fast and infrastructure cannot keep up with demand. So it sounds like we just heard from Lebanon's mayor that they're working very hard to find that sweet spot, and I think all of us are to one degree or another in our communities. We in local government always are looking for that sweet spot, that place where our economy is growing and in balance, but not so fast we burn out, as I was saying. The region's annual population growth, 1960 to 2014, was 1.4%, slightly lower than the state's 1.5%, yet above the national rate, which was 1.1%. However, growth in the region has slowed since the 2010 U.S. Census. The annual growth rate over the last 4 years, 2010 to 2014, was 0.7%. Our region's projected annual growth over the next 10 years, 0.9%. If this growth rate remains unchanged, our population will double in about 70 years, totaling a population of about 500,000 region-wide. Household income is also important to us. It's what we make from wages and salaries and what we can spend to keep our economy growing. According to the U.S. Census Bureau's 2013 estimates, the region's median household income is $46,362, ranking highest among a handful of peer regions that we analyzed across the country. The region's median income is slightly above the southeast Idaho area's estimated $45,024. The peer region with the lowest median income is the Brazos Valley, Texas area, $40,978, while the northern Arizona area is estimated slightly higher at $42,172. Residents in our region, on average, spend almost 50% of their income on housing and transportation. Food and insurance are the third and fourth largest shares of our expenses, and the fifth, which has been rising for decades across the nation, is health care. To this end, we collected data on health care in our region, as well as various health and medical access indicators. The Affordable Care Act began implementation in late 2010. While a politically charged policy, its implementation has had dramatic effects in our region. In 2010, an estimated 16.7% of Oregonians were without health insurance. In our region, the number was close to 16%. As of 2014, the number of uninsured in our region dropped to just 3.3%. 31,000 more residents have medical insurance coverage in our region than they did in 2010. Having insurance can save a client almost half the cost of being uninsured. Discounted rate plans and in-network coverage are a huge benefit to those with public and private insurance. It's also important to note that our region, state, and our local health providers have been testing unique programs like hospital to home and living with chronic conditions, which are aimed at reducing healthcare costs by managing patient needs and hospital visits better. Keeping a patient out of the hospital for often unnecessary visits through managed in-home care can save the insurer, the state, and the client tens of thousands of dollars. Aggregated across our population, we can eventually see millions in saving in our healthcare system and better managed care for patients. As much as income and healthcare are important, so is access to vital community services. This next map shows the ambulance and emergency services coverage in rural and urban areas. Given our small size of population but expansive geography, our region is generally well covered in emergency services. Location and access to services also reduce insurance rates. Premiums can begin to rise by as much as 20% if your home isn't within 5 miles of a fire department. Depending on the distance, the cost of insurance could double. Just as important as the proximity of a home to a fire department is the proximity of a home to a fire hydrant. If no hydrant is within 500 feet of a house, fighting fires becomes much harder. Again, it could make as much as a 20% difference in your premiums if the home is farther from a hydrant than that, with the increases escalating with any added distance. This coverage is also a good indicator for the general health of our communities and the attractiveness to those who may want to move in. There are also 5 hospitals in the region, all part of Samaritan Health Services. Samaritan has 5 insurance plans serving more than 45,000 people and over 70 specialized in primary care clinics. And this provides the perfect segue to our keynote speaker for this morning. It's my honor to introduce you to Ms. Kelly Kaiser. Kelly is the CEO of Samaritan Health Plans and Vice President of Corporate Services for Samaritan Health Services. She joined Samaritan in 1995 and is responsible for the Intercommunity Health Network Coordinated Care Organization, as well as Samaritan Health Plans, a state-licensed insurance company with Medicare Advantage plans and commercial plans for employers. Kelly has also served as a governor appointee to the Oregon Medicaid Advisory Committee, is the past chair of the Corvallis Chamber of Commerce, and currently serves on the Chamber's Business Advocacy Committee. She serves on the Oregon State Credit Union Supervisory Committee as its secretary and the board of the Oregon Healthcare Quality Corporation, and is a member of the Oregon Health Leadership Council, in addition to serving as a member of the Oregon State University College of Public Health and Human Services Community Advisory Council. Please join me in welcoming Kelly to the podium.